Thank you, Mr. Speaker. To the bill.
To the bill.
Colleagues, I was a no vote on this bill as well in committee. And for me, it was sent here, and it was an honor to be put on health care to find ways to drive down the cost of health care. And if you heard me say Senate Bill 86 that I carried a second ago, I thought was the best piece of legislation we moved out of the Health Care Committee, because that bill allowed us to start contracting with our doctors individually and cutting everybody else out of the middle. We could pay our doctors $50 a month, and they will take care of us and see us for anything that we need to be seen for. It allowed us to do a one-time pay straight with the doctors for $100. There's companies like Zoom Care out there that are set up on a fee-for-service basis where you walk in, you hand them $100, they'll go in, see you have a sinus infection, hand you a prescription, you walk out the door, and you're done. Those are the kind of things that we're looking at doing in healthcare, where we need to reinvent the way we deliver the system, get back to the basics. When we went to the doctor and there's only one person up front who scheduled appointments and handled all the billing for insurance. Now you have 6 people up front handling all of the billing for the insurance companies. You go to Zoom Care and you give them insurance, it's $140. If you go to them and pay cash, it's $100. Colleagues, this bill is forcing people into a healthcare exchange, small businesses. Is what it does, it allows a tax credit if you buy in the exchange. But if you want to continue to buy from your insurance company down the street who may not have a policy in the exchange, they do not get the tax credit. They are not allowed to get a federal tax credit if they purchase their insurance for their employees outside the exchange. The problem is the cost of insurance, how much it costs to deliver health care. Those are the issues that we really need to be addressing. This is just a stream that we're looking at putting everybody into one area where we still are not containing the cost of health care. The bill brings more people in the middle of the stream to drive cost up, the way I see it. We have navigators, we have health insurance agents. Okay, right now this is to bring a business plan back to us, but the federal mandate is that it has navigators. Nobody knows for sure what that job description of the navigator is. Who will be the navigators? We hear Farm Bureau thrown out. We hear the Cattlemen's Association. We hear ACORN. We hear the Bus Project. Heard United Way. Different people to be navigators through the system. Why do we need to pay these people when we have agents who work on a commission basis? So there's a lot of issues that need to be addressed in this, and I think we could address them without a bill and put the plan together, then create the bill once we have a plan. But once we put this through as legislation, everybody in this building knows it's tough to overturn a piece of legislation that has been put in place. This is total $54 million. They're talking about $48 million for a software product of creating the exchange. You could buy an incredible software company for $48 million. The state of Utah developed their exchange for $600,000. I think I saw a representative raising his hand wanting to sell a software company. So $600,000 is what the state of Utah used to build their software exchange. We're looking at $48 million. Colleagues, this doesn't make sense. We need to sit back, have the plan in place, have the numbers in place, just like you're doing a business plan for anything else, and then attack this exchange and what we're going to do. But our focus should be on driving the cost of health care down. We've done nothing with tort reform. We've done nothing of any substance to really drive down the cost of delivering care. And the first bill we had was Senate Bill 86 that I just carried a moment ago that actually did that. To me, that is the bill we need to focus on and start growing from there for coming up with a way to deliver health care. I urge a no vote on this, and I urge everybody to concur with that.